Welcome back to Iowa Live. We are being joined by a friend of ours, Dr. Patricia QUINLISK, in studio with us, dementia prevention instructor. Save Your Brain. We talked about that before on the program, Dr. QUINLISK, and you brought a couple of folks here that are all part of a project and a program that you have. First of all, let's talk a little bit about Save Your Brain.
Well, what we do in Save Your Brain is we help people make the changes they need to make to reduce their risk of dementia. And people don't realize this, but you can actually reduce your risk of dementia over 70%. And they estimate that over about 35% of all dementias in our community can be prevented. Which is prevented. Because the bad news is once you get dementia or Alzheimer's, there's really nothing medicine can do. Really,
and that's what the Alzheimer's Association too is really focusing in on, is trying to prevent the onset of dementia, because once the ball starts rolling, then it's a little too late.
Well, if you have what's called mild cognitive decline, and that's where you're still living independently, but you're starting to forget people's names, lose your keys, things like that, there's some evidence that with this kind of program, you can actually reverse that and go back to good mental health. Problem is, once you really slide into that dementia part, there's nothing that seems to work.
Yeah, but there's hope.
There's
what we're talking about here.
Absolutely.
Now, who's helping put this all together?
Well, we got together with Broadlawns Hospital, the Iowa Department of Public Health, the YMCA, and Community Health Partnership, which is the one who does a lot of the reduction of risk after heart attacks and cancers and stuff. And we all got together and said, we've got to help people make these changes because dementia is such a big problem in our communities.
And let's talk specifically about the state of Iowa. How big of a problem is it here in the state of Iowa?
Well, right now in Iowa, it looks like Alzheimer's alone, which is about 70% of all dementias, but Alzheimer's alone is the third most common cause of death among women, and probably somewhere around the fifth or fourth most common cause of death in everybody.
Wow.
It's just going up and going up and going up. And in Europe, there's some places where it's the #1 cause of death.
Is it really?
Yeah.
It's actually frightening, isn't it?
It is. But again, the good news is, even though medicine can't do anything about it once you have dementia, there is a lot you can do to prevent yourself from ever getting it in the first place.
And what type of things are we talking about?
Well, I hate to say it, most of them are lifestyle changes, which are hard. We know that that's one of the hardest things to do, is change our behavior. But they're the things you hear about all the time, things like eating right and staying active. But then there's things like staying social. You wouldn't think it, but being lonely is one of the highest risks for dementia. Being lonely.
I never realized
People didn't realize that. And then just using your brain, that old use it or lose it thing, that applies here to your brain.
Keeping the synapses firing, right?
Yeah. But then little things like hydration and making sure you can hear well and sleeping well. So these are all the things that we go through in this class. We not only talk about it, but then we get you tools to help you do it. We get you the social support to do it. We connect you with classes. So that everything is put in place basically to help you make all the changes you need to reduce that risk of getting dementia.
Now, speaking of the classes, we have a couple of folks that have been participants in the class. We have Bob Dunaway and Susan Skinner here. Not only is Susan a former participant in the class, she's won on a little bit more too, hasn't she?
She has. She helped us this fall in teaching some of the classes we had this fall, and then now she's going to be one of the instructors, because we've got so many classes going now that I can't teach all of them. So Susan's now come on to be another instructor.
That is awesome. Bob, we're going to start talking with you because you're part of this class, and we want to find out how you got involved. Why was it so important for you to get involved in this class?
Well, I had felt, like many people do, that sometime I might lose some of my capabilities to think as I would like to and enjoy life as I would like to. So that was my incentive. But my wife was in the first class with Susan, and she came home and was all excited about this class. And I think toward the end of it, she knew that there were going to be more, and she decided she was going to talk me into it. Well, she didn't have to talk to me very much, because when I could see what it meant to her, it was really going to be worth it.
What made her so excited about it, if you can express that to us?
I think just all the parts of it. She's a retired dietitian, so the food part of it, the diet, and I think just the whole package. You know, we're not going to change everything. We're not going to change everything in our lives, but we can make some differences.
Right, and you knew that making these small changes could pay big dividends.
And my big thing is quality of life. I've had a heart attack, or I've had heart attacks. I've had heart surgery twice for bypasses, and I'm a diabetic, and I've had many strokes. So have all these things that I figure if I can change just enough to maintain my level, then that's going to be great.
Dr. Quinlisk, those are high risk factors, aren't they?
They are, unfortunately. Anything that's a chronic disease, whether it be diabetes, high blood pressure, things like that, actually put you at higher risk of dementia. But again, the good news is that they've done studies with people with those kind of risk factors and shown that if you make these small changes in your behavior, you can actually substantially reduce your risk of dementia, including people who have the genes for dementia. Even in those people, this works.
Wow. Susan, what brought you first into the program?
Well, I worked in senior services for about 12 years, and so I got to watch folks age in many different ways. And some folks aged beautifully and were cognitively sharp and physically active right until they died or shortly before they died. And other folks had a much different progression. And so I asked myself, you know, what vision would you like for your old age? And it was, of course, the folks who were aging actively and staying sharp. And so I had to make some changes, and this program just puts it all in a beautiful package, how to make the behavior changes, and then the incredible support in that group, which I think is what Bob was describing. His wife, Marvel, was so impressed with not only the material, the different pillars of health that we tap into, but the support of the group was phenomenal.
Right. Now, you mentioned the older folks that got into this. You're not an older person. Why did you get involved in it at such a young age?
Well, I think the research is pretty compelling that you need to make these changes 20 to 30 years before you're old. Or in other words, the progression of the disease starts before the first symptom.
Okay.
So if you're in your 50s and 60s, that would be my big takeaway for folks out there who are 40, 50, 60. Make these lifestyle changes now.
Got it.
Before any symptoms develop, because this is where you really have the big impact. And they're not hard changes. A behavior change is hard, yes, but Patty makes it so much fun. You know,
I would imagine.
Oh, and she's doing it right there with you. I mean, we're setting goals, she's setting goals, and that makes it fun.
Dr. Quinlisk, when could we get involved in the classes? There's probably some people watching right now saying, this is a great idea. I agree with what Susan and Bob both had to say. I want to get into the class. How do I get in?
Well, classes are going to start next week. We've got 4 different classes.
Next week, okay.
Sunday, Monday, Thursday, Friday, different times of day. And all you have to do is call the Community Health Partnership, and I believe you have the number up there, but it's the number is 575-9220, or you can just go to info@my-chp.com, or just call the Alzheimer's Association. They'll give you the number too. Just call them, but sign up now. The classes are filling up, but we want to have the classes full so the most number of people can benefit from
And how
this.
long are the classes? How many weeks?
They're 10 weeks long and 2 hours each time. But we do a lot during that time. We do a fitness test. You get an individual session with a dietitian to find out how you can eat better.
Right.
You get to sit down with a pharmacist. You bring all your meds and they tell you about.
Really?
Yeah, because people don't realize that there's some meds that us older people shouldn't be taking because they raise our risk of dementia.
Wow.
You sit down with what's called a nurse navigator in case you have chronic diseases like Bob or something like that to make sure that you're getting all the support you need for your diabetes or your heart disease. And you also sit down with a fitness coach. And we'll get you connected with classes if you need help on balance or you need help with just doing strength training, whatever it needs. So
the balance is really key, isn't it?
It is.
That's one of the things that some
is.
older folks that we know, including my dad, said balance is really the thing that keeps them sharp.
Absolutely, and we know people who have fallen, broken bones because they have trouble with balance, and then that just starts that whole downhill slide, and we just don't want that. So balance is critically important, especially as we're going into winter here in Iowa.
No question about it, and you have to be careful. And we
do.
haven't seen winter really around here yet, but it is coming, you know it is. So let's get a jump on this as soon as next week.
We start next Sunday, so call today, tomorrow, get signed up and start coming, and I think you'll be glad you did.
Yes.
You recommended, right?
Highly
Susan?
recommended.
And Bob, you give your thumbs up too?
Very much so.
Okay, and if you're a Y member, you get a break on the cost too. So.
You do. And by the way, in case there are people who even find the the $100 fee a little bit too much, we actually have scholarships for people.
And-
Because we want there be no barriers to anybody who wants to take
And
this
they can
class.
find out that information how?
By calling at the time that they call in to sign up for the classes.
mention
say,
that.
I'm going to need a scholarship, and we'll get them one.
All right, that's the 575-9220.
That's right.
All right, wonderful. Thank you, Dr.
Well,
Quinn.
thank
It's
you
good
for
to see
having
you.
us.
Susan and Bob, thank you for being here. We appreciate your time. All right.